Hi, and welcome to Tech Leader TV. I'm your host, John Thomas Flynn, and this show inaugurates our 13th season of TLTV, a live streaming video webcast and television program viewable by anyone with a computer, a modem, smartphone, or Comcast. Of course, we come to you today, as we do every day, courtesy of our sponsors: Veeam, Advanced Onion, Akamai, IP Solutions, Carasoft, Digital Dreams, LexisNexis, and our newest sponsor, Federal News Network, the key source of breaking news, information, and analysis for those who support the missions of government. We have another very exciting show today with distinguished representatives from the largest state agency in California, the Department of Healthcare Services, at over $104 billion, counting all funding sources. That's 250% more than when Governor Brown took office. To put that in perspective, DHCS's budget is larger than 48 other states. Budget exceeded only by New York and just about equal to the entire budget of Texas. As I like to recall, when I became California's first CIO in 1995, I was asked what the biggest difference was compared to my previous job as the first CIO for the Commonwealth of Massachusetts. I replied that most of the challenges and issues were very similar. However, California's challenges and issues always came with 3 or 4 more zeros at the end of it, and DHCS proves it. Well, before I introduce our guests, I'd like to take a few minutes, as frequent Tech Leader TV viewers are known to relish, to pontificate, if I may, on pressing issues of the day. As everyone knows who breathes, we had an election last week, and Gavin Newsom, a previous guest on Tech Leader TV, I might add, was elected as the Golden State's 39th governor and will take over the reins from Governor Brown on January 7th of next year. California was one of about a dozen states that elected new governors but stayed within the same political party. In addition, while there is one state, maybe 2, undecided, so far 8 states flipped parties. Consequently, big changes ahead. While flipped states, without a doubt, will certainly have new CIOs come 2019, I also predict that most states which stayed within the same party, like California, will probably appoint new CIOs as well. That's not always the case, however, as we'll see in just a minute. But the fact remains, there's potentially 20 new state CIOs coming in early 2019. And anticipating this massive changing of the guard, so to speak, there were more than a few CCR, Chief Information Officers, among the throngs at last month's National Association of State Chief Information Officers Conference, NASCIO, in San Diego. What's CCR? Well, that's my term for carrying a concealed resume. And that made a lot of sense, according to NASCIO Executive Director Doug Robinson, who said, nowadays, every state CIO is appointed by their governor. Ironically, my friend, Delaware CIO James Collins, who was elected the new president of NASCIO in San Diego, actually survived such a situation after the 2016 election. In that race, then Democratic Governor-elect John Carney asked Collins, who was appointed by outgoing Governor Jack Markell in 2014, to stay on. So it can happen. And so, for those 12 CIOs in similar circumstances to Collins, besides the Sturm und Drang surrounding all administration changes, there's also a great opportunity for state CIOs to provide their new bosses and the new transition teams with a new vision for the immense strategic value of technology. As New York State CIO Bob Sanson told us during his Federal News Network interview a few weeks ago, CIOs need to get in front of the new governor and describe how meaningful technology change can happen. Every single aspect of state government is touched by technology. It touches everything you do and everything you want to do. That's good advice indeed. For the other CCR CIOs in the 8 or 9 flipped states, the writing's on the wall. Let the job searches begin. Finally, with regard to the vendor community, you know who you are. Hopefully you've been planning for the successions for months, preparing strategic IT action plans, priorities, and recommendations, and getting them in front of the governor, the candidates, and their campaign teams. Now it's time to do the same with the transition teams themselves, which are already assembling. So good luck. As I like to say on this show, the state of California can always do better. So let's continue our journey today as we discuss government, politics, technology, and as I like to say, other unnatural acts. We'll be right back in a moment with our guests, and we'll get started. Hi, and welcome back. As I mentioned, our guests today are Dr. Linette Scott, the Chief Medical Information Officer and Deputy Director at the Information Management Division, and Chris Riesen, the Chief Information Officer, both at the California Department of Healthcare Services. Linette, Chris, welcome to the show.
Thank you.
Excuse me here, we got a new table. I'm not quite used to it. I want to get into talking about data analytics. It's one of the hot topics that we talked about before, and we really wanted to get into with what's going on in healthcare services. But first, you know, it is such a Goliath of an agency, so I want our folks to, and myself, to understand how it all fits together in terms of your roles and responsibilities. So, Linette, as I understand it, are you the first Chief Medical Information Officer for the state?
Yes. You said
Should I rephrase that question?
You said in the state, so I'm not actually sure that I'm the first in the state, but at the Department of Healthcare Services, yes.
Okay.
Yes.
And what is your role there?
So as the Chief Medical Information Officer, I'm a physician, and I'm board certified in preventive medicine and clinical informatics. So I work across the various department programs, as well as with our partners and stakeholders related, kind of all things related to data. Understanding how we collect, manage, use, disseminate, share, talk about, and analyze data. And in an organization, as you mentioned, as large as ours, we have a lot of data, to put it mildly. So it's been a fascinating journey, though. As I came to the department in 2012, it was a new role, and the role has, I think, grown and matured some over that time. And certainly one of the things that has been a real pleasure throughout is the partnership with the information management side, so to speak, which is that role, as well then working with our technology side. So the Chief Information Officer is the key partner, working very closely together as we look at how we provide data and information to the department and to our partners in consistent and standardized ways that produce results that can be used for decision making.
Okay. And Chris, you know, you're not the first CIO for DHCS. Certainly we've had Chris Cruz and a number of other representatives from your agency, but you're the first one to come over from the lottery, huh?
I would
Tell
assume
us
so.
Tell us a little bit about your background and what your role is.
Well, longer than my time at the lottery, I spent about a decade or so with the pension systems, and so in both of those I was the chief architect and had involvement across the organization, mostly in terms of, similar to what Linette's talking about, right? Supporting the organization, supporting it strategically, looking at where it's going, helping it to understand how technology will support it being successful in the future. Went to lottery, had the CIO role over there for about 4 years, and similar role, right? I look at the CIO role as it's my responsibility in the organization that I'm responsible for, their responsibility to make sure that what we're putting in place and where the organization is going is supported by the technology, that we're making sure that things are staying, going in a direction that is useful and beneficial, not just sort of responding to a need, but being a partner at the table and helping to identify opportunities for growth or being able to advance. Lottery, obviously very different, revenue driven, and so a lot of my role there was spent working with sales and marketing and understanding how we might be able to grow revenue, grow sales, Obviously, at healthcare services, it's not a focus on revenue. It's much more a focus, obviously, on Medi-Cal and where we're going.
And a few more zeros at the end of DHCS, right?
Yeah, both dealt with billions, but definitely more billions over at DHCS.
Well, Lynette, your division, information management division. Tell us a little bit about that, how that's organized within the structure. Because when I went through the website, there's a lot of different divisions or offices with the information in the title, so I was a little confused by it. So straighten us out.
I'll see what I can do. Well, it's a relatively new division in the department, so have had that division for a few years, and actually part of creating that came out of the guidance that we received from our federal partner, Centers for Medicare and Medicaid Services, CMS. CMS has been working with states around an initiative called MITA. Medicaid Information Technology Architecture. And one of the things as I came to the department, really partnered with our CIO, Chris Cruz at the time, and others, and looking at how we could embrace the goal of MITA as a way to help drive change. And so we created, and actually I think we had the chance to present this a few years back, created a picture that showed sort of what does it all look like, our strategic plan, quality strategy, and MITA all in one picture. And part of that is that it really is about how do we organize the business, so the business processes, how do we deliver services to our members through the Medicaid program, how do we manage information, and how do we manage technology, and how those things all fit together. And so one of the things that we found is as we think about the information management piece and the technology management piece, it's very synergistic. You can't do one without the other. Our data is so big, you can't do it without technology. But we often are coming at it from a slightly different direction. So as I look at information, part of what I see is how do we use the data? How do we interpret the data? How do I make sure that when we have two different areas using the same data, we're coming to the same results for the same kinds of goals, but coming at it from a different direction? Chris, from the CIO perspective, may be looking at things and saying, well, how do we use comparable technology? What does my support load look like? What is the training? What is the server base? So we're coming at it from two different directions, but the ultimate goal is the same. And so the development of the Information Management Division was really to give that piece of voice. And I think the way we've seen that emerge in other arenas is the emergence of the idea of a chief data officer. And so that's also something that's been talked a lot about.
Yeah, we're going to talk about that in a minute. It's certainly
okay.
a timely topic.
Jumping the topics on you. So as the Chief Medical Information Officer, it's very much like the idea of a Chief Data Officer with that focus on the use of the data and how we use it, and then partnering, of course, with the CIO around where do we put it, how do we move it from a technology base. So my shop is particularly concerned with those kinds of perspectives, and also the standards piece. So very focused on how we are compliant with standards, moving towards national standards, which also then helps with consistency and use and interpretation of data.
I know, as you said kind of in the beginning there, the whole issue of business technology alignment. It is critical, it's a challenge. The whole idea of, it's really been on the front burner for a number of the last few years, I'd say. And it's going to be even more so, I think, because people realize that you can't have the technology people driving these projects. It's got to be the business people. And certainly having a business executive champion is the way to go if you want a successful project of any kind.
Yeah, and we both see ourselves supporting the business.
Yeah, and MITA, actually, just to add on a little bit, is something that actually helps with that. This is the first time I've been joined an organization where there was actually an architecture framework that was prescribed by an entity outside of that organization.
Did I understand it came from the feds? Or? Okay.
And so MITA actually helps to create better alignment between business, information, and technology.
Did that come with a carrot as well as a stick in terms of implementation?
It did. So MITA's actually been around since the mid-2000s. It's not new at
Never
this
came
point.
up on this show before.
Yeah. Well, when we first started working with MITA, it was put out as an initiative, and the idea was looking at how we do our business activities, how do we streamline, improve efficiency. CMS realized that while there were different Medicaid programs in every state, core functionality was the same. We serve members, we have contracts, we do eligibility and enrollment for members, providers, et cetera. And so they looked at how we put that together. Since 2011, I think they're about 2011, 2012, CMS has really put an emphasis on the carrot and stick piece. So, so there's an opportunity for us to apply for enhanced federal funding to support our automation efforts and our business process improvement efforts that will move our MITA maturity, the idea of maturing the organization and the way we do our work. And there's also the stick, so to speak, in that if we want to have two separate systems that do exactly the same thing, we can, we just won't necessarily have federal funding to support it. So, so that's part of the engagement. But we're excited by having that opportunity to work in partnership with CMS and to be able to take advantage of that, because it really is what's right for our members, for the people we're taking care of, as well as for the taxpayers.
Has that generated any vendor interest in terms of the ability to vendors to bring solutions to help you implement the MITA standards or framework?
I would say so.
There are vendors that are beginning to align to it, just like we're aligning to it. And so because there is an expectation from CMS in terms of using MITA that you implement technology in the way that it prescribes, then vendors can begin to build solutions that align with it as well. And part of what we look at in terms of being efficient at implementing change in the technology and such is, are there solutions out there for us to use rather than we're building it?
Let's talk a little bit about your organization, EITS. Is it Enterprise IT Services? Or?
Enterprise Innovation Technology Services.
All right, that's an interesting term. Tell a little bit about that organization and your staff, et cetera, and budgets, things like that.
So it's a typical IT organization, right? It's the centralized IT organization in healthcare services. Today, we provide support for a lot of the legacy systems that are in place, things that I'm sure we're going to probably chat about in terms of modernization going on. And sort of, run-of-the-mill IT services out to the rest of the organization, supporting all of the day-to-day business operations. There's a lot of applications, one-off applications that exist as the various health departments have sort of changed configuration over time, and new applications and even IT organizations have been combined together. And so it's nothing different than a lot of other IT organizations, but as you mentioned earlier, it's a large department and a large organization with a lot going on and a lot happening in terms of those business operations. And so
and your organization itself, did I understand you've got a relatively new Chief Technology Officer or some other changes in your leadership?
Yeah, when I arrived back in July, there were two positions that report directly to me that both were vacant, and so started recruiting for those immediately. Importance in terms of getting the leadership team in place and being able to have those positions, which are important.
And you filled at least one of them, haven't you?
Yeah, so Toquin Collier has been put into the Chief Technology Officer position, and we're getting close to the end on the Program Management Officer position too, which is over our Project Management Office and Enterprise Architecture.
Okay. Speaking of your Project Management Office, always been interested in the whole relationship between HHS, DHCS, et cetera, and OIS. OSI, I'm sorry. Office of Systems Integration. Do they oversee your projects, or are they strictly social service? Okay, they do.
It depends upon the nature of the project, right? OSI has a greater ability to run projects that are cross-department. Right, and so in our agency, there's a lot of projects that affect multiple departments, and so OSI has an ability to run those projects.
Lynette, back to you. How has the whole issue of health IT, how has it changed the industry?
It has been a fascinating journey. I actually started my career in the United States Navy, working with sailors in Norfolk, Virginia, and did some work in an acute care clinic off-site as well. And at that time, which was a few years ago now, when I was in the Navy, we had paper charts. So medical records, sometimes thin, sometimes 1.5 inches thick. And because I worked with the ships, sometimes we had folks come in, but they didn't have their medical chart. But we did have electronic labs, electronic prescriptions. So I could often put together a pretty good picture based on what I had electronically. When I worked at the acute care clinic, it was all electronic. There was no paper whatsoever. And so the ability to look at the history for a patient as they came in and be able to understand what was going on and having legible notes because they were typed is also a bonus. So my experience as a clinician convinced me that moving to an electronic-based environment in healthcare was definitely the direction to go. It has been a journey. And so in 2009, HITECH was passed, so Health Information Technology for Economic and Clinical Health Act,
Federal.
as part of the American Recovery and Reinvestment Act at the federal level. And that program really set in motion a number of programs with funding that were continuing the executive order started with President Bush in 2004 to really move health IT in the healthcare industry. And the goal with those programs was really to create a tipping point so that we would get over the hump from moving from paper to electronic. And I really think that has happened. We have folks now that are clinicians that have never touched paper. They've been in electronic-based environments. There are lots of conversations about how we can make electronic health records better and more user-friendly for our clinicians, which is absolutely crucial. But as we started the journey in 2009 with the passage of HITECH and then adopting the various grant programs that came into the state in 2010, 2011, at that time, it was literally, can a provider adopt an electronic health record? How do we move there? Mm-hmm. And we were asked to try to have the conversation about health information exchange, connecting electronic health records. People weren't ready for that then, and we just didn't have enough adoption. Now, almost 10 years later, we have enough adoption. We're heavily focused on health information exchange, and both at the state and federal level, we're putting money behind that.
Tell me about it.
So, and it's interesting because in 2011, as part of the HITECH Act, as a state, we received a $38 million grant to specifically work on health information exchange, connecting electronic health records. Okay. We are really thrilled. The past summer, the legislature passed as part of the budget funding that we will be able to combine with enhanced federal funding from CMS that will have the opportunity to be a $50 million program to advance health information exchange.
Yeah,
and we've got to do it over the next 2.5 years. So we're energized and motivated.
Okay.
Yes.
Interesting. No, I happen to. I'm not asking you about this, but I just to throw it on the table. I happened to come across in some of my research on major IT projects and funding and the case study, new FSRs and all that thing, that there's I think it's a $450 million project at the Department of Corrections to put in electronic medical records for prisoners. $450 million. I'm not going to ask you to comment on that. I just wanted to throw that out there.
But I am very familiar with the project, yes.
My God. Anyway, Chris, you talked about it a little bit, but what are some of the major initiatives that we'll be seeing over in your Department of Healthcare Services over the next year or two?
Right, so as I alluded to earlier, there are a number of modernization projects going on. As you may guess, right, there's quite a bit of technology within the department. A lot of it is quite old, 20 years, 30 years, even maybe 40 years old. We've got mainframe systems and such, and so we've got challenges in terms of being able to implement change quickly, be efficient about it, cost effective and such. All the systems work, right? We process the claims, we make sure that the money's flowing, and so all of that works well. However, right, we struggle with implementing changes, and so we've got a number of large modernization projects going on, some within the department and also some, as you mentioned earlier, being led out at OSI. Mm-hmm. And so it's those modernization projects that are going to be a big focus for us as we continue to push down the path of how do we get to a place where, like we talked about earlier, right, the direction that CMS is pushing us in, that MITA prescribes for us, and have technology that's modular, that's able to change quickly and be flexible for as the landscape around healthcare changes as well. Along with that, obviously we have to bring people and process and such along, and so we've got the challenge of, as we modernize the technology, we also need to modernize the workforce. Mm-hmm. We've got a lot of skills and knowledge in terms of what we do today, but there's a lot of changes happening in terms of how we deliver solutions and technology, and a lot of the big projects around the state are using things like Agile and developing in the cloud and so on, and we're headed down the same path, and so we've got to make sure that our staff in the organization understand how that environment works and are a part of all of that, and in addition to that, the processes that go along with it. And so we're doing a lot of modernization,
and
technology, people, and so on.
I would assume just because of the size, most of them are competitively bid opportunities for your constituencies out there, right?
Yeah, absolutely. Yeah. And there'll be a number of procurements that are going on through the years to come.
Oh yeah, when you got $100 billion budget, I bet. How much is the IT budget, I wonder, of healthcare services? You have any idea?
Well, it might depend upon how you look at it and
most
where all
of that
the dollars
is
are.
Healthcare, right?
Yeah,
sure.
yeah. Most of the $100 billion is all going out to the counties and such in terms of, right?
Yeah. Okay, let's talk about data analytics. I had Bob Sampson on my show back east recently, and he's the New York State Chief Information Officer, and he said data is the new oil, the way he put that. And of course, that's probably not a good analogy for the fossil fuel hating California, but you folks get the idea. My controller, when I was in Massachusetts, Bill Kilmartin, he said the data is locked up in jail. And it really was. And it's sort of immense and critical and valuable. And we're just getting started really and realizing its potential. So what are some of the data analytic drivers at healthcare services?
Well, it's interesting that you give the analogy of the data being locked in jail. We have both as a department and as an agency, a health and human service agency, have been committed to the idea of freeing the data, so freeing it from those jails, and really making data available to the public in a much broader and a more reusable way. Our Secretary Wilkening has been a fantastic champion for us and helping to set the stage, set the drivers around how we look at data and share data both between departments as well as with the public. So we've been doing that in a number of ways. Part of that has been through our open data portal. So we have a shared platform across all the departments in the Health and Human Service Agency, of which Healthcare Services is one. And there's now over 300 data sets there. So
and these are available to the public?
It's available to the public, and it's all API enabled. So all the programmers out there should be taking a look and seeing what they can do with that data.
Is much of that happening?
It's hard to get a sense of it. That's one of the things we've been working with our partner on.
Do you have to register to use it, or
nope.
No? So you really don't know? You won't know who's using it?
So no, that's one of the challenges, and I think that's one of the things that has
you got to get somebody from Facebook so they can
makes
take pictures
people.
of this.
I know, makes people nervous. When you share data, because once you've released it, you don't know where it's going to go.
Yeah.
But the whole idea is that we have an informed public and an informed populace. And so so making data appropriately available, we've developed an open data handbook. We also have developed data de-identification guidelines so that we're keeping that balance between protecting confidential information and sharing data publicly.
And what are you trying to do to get a better handle on the utilization of it?
So, I mean, we've been taking a look to see what we can do in terms of either just like website traffic analytics, or if there's some other ways we can get a handle on it. Interestingly enough, one of the ways I get feedback, and I know that the data is being used, is if anything happens and it doesn't work for some reason, we get emails. So it's the whole negative response. But it's a good source. I mean, we have folks writing to us and saying, hey, you know, we're working on.
Well, that's testing the value. So what's the valuable stuff? That's
creating
a good idea.
Creating the interfaces and using the data and using it to look for things.
And I would imagine most people that do seriously get involved in that would be checking back to, hey, here's what I found, or here's what I didn't find.
Yeah, so it's definitely been an exciting transformation, just watching the way data has become more available.
Yeah. And then there's there's this whole transparency issue, right? The Freedom of Information Act, there's California, what is it, California Records Act.
Yep, the
all
Public
these
Records
have
Act.
implications, right?
Yeah. So it's been an exciting journey.
I think something that's important as we modernize the technology, right? That's involved in housing all of the data that we have, and obviously generating it and so on, is keeping this in mind, right? How do we make sure that we don't think about the data and the use of the data at the end and just tack it on like oftentimes we have to do today, especially with all of the older technology that we have, but actually keep that in mind as we're implementing the changes that we have ahead of us, so that things like the open data portal become something that is just a natural outcome, as opposed to something we have to work at in the end. Because we put a lot of effort in, Linette puts in tons of effort right around all of this in order to ensure that we can get that data out there. Right. But we can think about it differently as we move into the future.
We had a show a couple years ago when Chris Cruz was in your seat. And we had Bruce from your Audits and Investigations, Bruce
Lim.
Yeah, right. Yep. And a fellow, Lawrence Wolk, I think it was named, from the Department of Justice, to talk about, we didn't call it data analytics then, we basically talked about detection of fraud. And that was, geez, this was 7 or 8 years ago. And since then, your department has embarked on a very large data analytics project there to identify, I don't know if you know much about that project or are willing to share it, but it certainly was, I mean, I remember reading the book License to Steal by, I can't remember the guy's name right now, but he's a former cop in London, and now I met him at the Kennedy School. And he estimates fraud in Medicare and Medicaid, as they call our Medi-Cal, that it's anywhere from 10 to 20%, and when you're talking millions of dollars, that's a lot of money. So that's a major initiative, and I'm looking forward to hearing how that's going probably next year.
Yeah, so we're very much focused on how we use data to look at various patterns. One of the things as we look at data patterns, and I think 10 to 20% might be on the high side. Our estimates have been lower.
I'll send you the book.
Yeah, everybody has a right to their own opinion. I have not read that book, no. But our estimates have been lower than that. Yeah. But that's not to say that there isn't fraud. We know there's fraud, waste, and abuse, right? That's why we have a very strong audits and investigation branch, and Bruce Lim does a fantastic job leading that team.
And certainly with that project, we'll get to the bottom of it, I would think.
And that's one component.
Yeah.
I mean, so one of the things, though, that is interesting when you think about data and how to use data to look for those kinds of things is that when you find an abnormality, a change, an anomaly in the data, right, that's just the start. It's what follows that leads you to the answer.
Sure.
Right? So we use that data to look at that. Sometimes it means there's fraud. Sometimes it means there's a data quality issue. Sometimes it means there's opportunities for quality improvement and training.
Right, and I was going to get to that. I was talking a little bit about how you can use that data to drive change in the organization, right?
Absolutely. Yeah, and so as we do that, one of the things we've also been very involved with is using data in the organization to report on performance measures and outcome measures. So we work closely with
performance measures.
I know, right?
Really?
Yes. So
I love performance measures.
We send them to CMS. So we have something, this also came out of the Affordable Care Act, the idea of core set measures for looking at quality across Medicaid programs. So there's a core set for adults, a core set for children. We've been reporting those annually for a number of years, and CMS actually puts that on their open data platform. So yeah, so statewide quality in the Medicaid program and having a chance to take a look at that is something that we do.
You know, one of the things that we always say, it's not the technology, it's the change management. And certainly when it comes to data analytics, I think a lot of the slow start, because there were a lot of barriers and challenges to getting things done. People didn't want people looking at their data. You know how that was. It's been that way forever in government. But people have finally gotten around that, haven't they? You've been able to address those fears, concerns, and make it look like, hey, this can really make your agency better. And you talk to the right people, you can get something done.
Yeah, and I mean, as we use data, we improve data. So when we know that it's being looked at, people focus on it, they give it attention, and they improve the data quality. So, so we're very much focused on using the data to monitor the program, to look at how various conditions are affecting our population, looking for fraud, waste, and abuse. So there's a wide range of ways in which we use the data. And as we do so, we continually work with our partners and our health plans, our providers, to improve the data that we receive so that we can accurately reflect the care that they're delivering and highlight the good work that's happening in the state.
Yeah. Well, and that you mentioned the performance measures. I had a conversation recently about that, and I always go back to Chesterton. He said about Christianity, and I like to paraphrase him and use it about performance measures. Performance measures have not been tried and found wanting. They've been tried, found difficult, and abandoned. And it's really true. It's very difficult in government to get those things implemented for a myriad of reasons, obviously. But it's going to be the way of the future, I think, for sure. Okay.
Yeah, they tell an important story about the kinds of issues that are affecting our members, as well as then the quality of care that they're receiving. And we really have, I think, excellent teams that are providing high quality services to many of our members. And sometimes folks focus on the negative and forget about the positive, but we have a lot of fantastic positive stories that Medi-Cal has been a true saver for our members that are receiving it.
I'm sure. A third of the state is on Medi-Cal.
Yeah.
Speaking of the Kennedy School, there's a woman named Jane Wiseman who just came out with a report on chief data officers in state and local government. Very interesting. She was interviewed actually on Federal News Network, part of an IBM program that sponsors it. But it was just, I think she said that half the states now have a chief data officer, and the larger cities have even more so, or the position is prevalent. California had a chief data officer for about 6 weeks, I think. I don't know what happened to that. But you mentioned, is there chief data officers now? Is that coming to the forefront in terms of departments? You say you
well,
really, it's probably one of your titles.
In a sense, I mean, so I can't speak to the kind of the broader state, but within the Health and Human Service Agency, one of the things that we've done is we've really been focusing on data. So I mentioned the open data, but we've also created a data playbook for the agency, and all of these things that I've referenced are out on GitHub, so they're available to the public to use, for folks to reuse. And part of that has been to really draw attention to how we use data, and in the process, there are a number of things that we've done. One of them is a data sharing agreement between all of the departments to be able to share confidential data appropriately and securely, to look at issues that cross program areas and cross departments. In that context, both in open data and in data sharing, we've identified data coordinators, so people to be leads around these data initiatives within each of the departments. And so, for example, my title is Chief Medical Information Officer. Folks have different titles in their department, but the idea of having a data lead within the organization that can help take care of these questions, get them routed to the right place, get the right people in the room, do the right coordination, has been a key role that we've been looking at and nurturing in the agency.
I'll send that article and a link to that
great.
study.
Thank you.
I think you really. When I was in Washington recently, they had a big data transformation meeting, and they had half a dozen state and local government CTOs in there, and it was very interesting. it's becoming well adopted around the country. I was really surprised at how prevalent it is. Yeah, and for obvious reasons.
Right.
The big controversy is, where does it report? It's like the CISOs, the Chief Information Security Officers,
Right.
would rather not report to the CIO, something else. They'd rather report to the governor or the director of the department or the secretary, et cetera, et cetera. I think the CDOs kind of feel the same way, that they think their role should be outside the CIO's office. And it seems like that's the way, the direction it's taking.
Well, we see the same thing. So in the healthcare industry, the CMIO is the role that is the comparable, and we see the same thing there. So different organizations are organized differently, and you see every combination, and there hasn't really been one that's come to the top. So each organization, kind of looks at what they need for the space they're in, I think, and settles.
We only have a few minutes left, so why don't you tell me, give me a 1 minute or so of some of the real success stories from your data analytical endeavors.
Well, in some sense, I think I've highlighted some of those. We've been really thrilled with the work around open data, making data available to the public. We've also been really pleased with the data reporting in terms of being able to do the reporting for CMS related to quality measures, the core set measures. But I think even more so is what sits underneath that. There's been a tremendous amount of work in the department related to how we use, organize, manage data that has really transformed over the last 5-6 years that I've been involved, and it's been going on for longer than that. But the focus on data quality, data usability, so that we can get to those endpoints that are visible to the public and to our policymakers. A tremendous amount of work there that has occurred, and just a huge thank you to everybody on the team that's been a part of that.
Chris?
So I think that the direction that we're headed, right, in terms of expanding out the use of data is, and all the work that's been going on to make it available has been extremely important. It's where there's a lot of crossover between our two organizations and in terms of the teams that Lynette's mentioning.
Well, it's interesting. I had an interview recently with a woman from Pennsylvania, Dr. Perry Rosen. They have a federal grant. Well, she started out by saying that the second leading cause of death among teenagers is suicide. I had no idea. And they actually have a program using data analytics to identify children at risk through a federal grant. Talk about using something with life or death consequences, that was certainly it. So it is an exciting area, and certainly the one that we're going to hear a lot more about in the future.
Absolutely.
Anything else before we go?
Thank you so much for having
Well,
us.
it's been very
Appreciate
interesting.
having me a
Like I
chance.
said, I could talk about these data analytics all day. I know that name of that cop from London will jump into my head soon, but it is a fascinating topic, and it is the data's in jail, and this is the new oil, and it can really make fundamental and fundamental changes in the way government operates, and not to mention how it deals with the public. I mean, when you give it'll be interesting to see what happens with that data when people start utilizing it and coming back and saying, here's what we found. Remember, we first did it when they used to put like locations of schools, so when you moved, you know what school district you're in.
Right.
Come a long way, baby, from that situation.
Right.
Huh?
Definitely.
Yeah.
Absolutely.
Well, thank you very much, and that's going to conclude our show for today. I want to thank everybody for watching. Please go to our website, check out our stories, and let us know what topics and guests you'd like to see on the program. I want to thank our sponsors, Veeam, Advanced Onion, Akamai, IP Solutions, Carasoft, Digital Dreams, LexisNexis, and the Federal News Network. The video on demand for this program will be available in 24 hours, I'm hoping, but certainly by the end of the week. We look forward to having you join us next time. We've already had some conversations, in fact, with a number of your colleagues about shows next year. So have a great holiday, and we'll see you next time. Thanks for now.